Hello, my name is Bob St. Peter. I'm a pediatrician and the former president of the Kansas Health Institute. Today is June 4th, 2026, and I'm in Topeka to interview Susan Concannon. Susan is from Beloit and was a member of the Kansas legislature for 12 years, serving in important roles in healthcare, children's services, and the state budget. Susan, welcome and thanks for being here.
Thank you. Thanks for having me.
This interview is part of the Kansas Oral History Project, exploring health issues in Kansas. The Kansas Oral History Project is a nonprofit corporation that collects and preserves oral histories of Kansans. This series is supported by donations from generous individuals and a grant from the United Methodist Health Ministry Fund. Our videographer is former State Representative Dave Heineman. Susan, again, thanks for being here.
My pleasure.
So tell me a little bit about yourself and where you're from.
Well, I was born and raised in Salina, Kansas. I grew up east of Salina in the country and had a wonderful upbringing with a family of 7, and we had every pet imaginable. I had a pony, and I was a 4-H'er, and I graduated from Salina Central High School. From there, I went to Bethany College, and I graduated with a Bachelor of Arts in Psychology. Met my husband there, and we went to medical school together.
Yeah.
I didn't go to medical school, but
It was a joint effort.
It was a joint effort. I worked while he studied.
That's great.
So.
And tell me, so you were in Kansas City and also spent some time in Wichita
Yes.
during that training.
Yes, at that time, the Wichita school was the 3rd and 4th year.
Right.
And so, yeah, we did years 1 and 2 in Kansas City, 3 and 4, and then he stayed in Wichita for his internship in internal medicine.
Yeah. And from there, you went to Beloit.
Yeah.
Tell me how that
yes.
came about.
Well, we were obliged to go to a smaller community in Kansas because of the Kansas Medical Scholarship. And we looked all over the state. We really struggled to find a community for an internist because he needed to have an intensive care unit to work with. And we had given up on that size of smaller community and were considering paying the loan back. But when we got a phone call to come visit in Beloit, we were pleasantly surprised they had a 4-bed ICU and very well-trained staff. And so that's where we went. I didn't really expect that would be our forever home.
Yeah.
But we fell in love with the community, and our kids started school there, and they were entrenched in the community. So that's been home for, I don't know how many years.
Plenty.
Almost 40.
Well, yeah. And a success story for the medical student loan program, keeping
Yes.
people in rural parts of our state. He went there after graduating, and 40 years later is still practicing in Beloit.
Yes, he is.
Yeah.
And he's maintained a relationship with the KU School of Medicine in Wichita. And at one point, the residents would rotate up through Beloit. The internal medicine residents would.
Well, with the ICU, that would be a good experience. So
Yeah.
he specialized in internal medicine, which, as you were saying, a lot of practitioners in rural parts of the state are family practitioners. Internal medicine maybe does a little bit more specialized work, so having the intensive care unit available was important to him.
Right.
That's
He
great.
takes
And
care
not a lot of communities that size have ICUs.
Yeah. Very, very sick patients, and
Yeah.
we were able to keep them in the community and at their hometown hospital.
Yeah.
I mean, they get to the point where he'll transfer them, but.
Was the area that you grew up in east of Salina, was that part of your district? I know your district came down to almost to Salina.
No, they would not have been that nice to me.
Okay.
No, they gave me the west side.
Okay. Great. So Tell me how you got interested in politics. Where did you get your interest and just putting your name in the hat that first time?
Well, growing up, my family was very apolitical. I know that my parents voted for both Republicans and Democrats, and I didn't really know the difference. I married into politics. My father-in-law, Don Concannon, was the Republican State Committee chair for 12 years in the 60s and 70s. And then in 1974, before I met my husband, was the first time I heard the name Concannon because he ran for governor. And he lost in the primary that was the year that Bennett won. It was a 5-way primary, and he lost to Bennett by less than 500 votes. At the time, it was the closest primary, but we've had a closer one more recently.
Yeah.
But
another Republican primary.
Yes. Yeah. And there were several attorneys in the family, and I just enjoyed the discussions. And then living in Beloit, I was involved in a lot of community service, and I enjoyed committee work, solving problems for the community, having a forward-looking attitude of how we can change to make the community better. I ran for city council and served on city council for one term. Then I ran for mayor and lost. So as my father-in-law would tell me, everyone should lose an election once in their life. 80s, early 90s, I became involved with the Kansas Medical Society Alliance, which was formerly called the Auxiliary. And one of the roles that I took on was working with the legislature advocating for malpractice reform.
Okay.
And I enjoyed that process and realized that the legislators were citizens. They're not all attorneys, or, I think we get that in our head that we have to know all about the law before we can go serve. And I really, at that time, kind of got the bug that I wanted to run someday. But I was raising a family, and I needed to wait till my kids were grown before I actually decided to run for office.
And I was looking at, amazing what you can find on the internet. You didn't have opponents in many of your elections, either in the primary or the general election. So how did you get recruited and sort of, thrust into that role?
Yeah, well, I kind of thought it wasn't ever going to happen. The opportunity hadn't. I was good friends with Elaine Bowers,
Who was holding the seat at the time.
Yeah, and but the year 2012 with redistricting, they had trouble creating the maps. Went to the judges. The judges came out with a new map late on a Thursday night. I got a call during lunch on a Friday. And my husband and I were in Wichita that day for something, and I don't answer the phone while we're eating meals. And so I looked at my phone and I said, "Oh, it's out. It's Topeka number." And he said, "Topeka calls are sometimes important. You better answer that." So I did, and it was a friend that knew that I was interested and knew with redistricting that I would be, and that Elaine Bowers was going to run for the Senate.
Interesting.
And so we drove from Wichita to Topeka, and I filed that day.
Yeah.
And then the filing deadline was on Monday, so I was unopposed. I couldn't believe it was kind of that easy. I paid for it later. I did have a couple of really tough primaries.
Yeah. In 18 and 22, I was curious, the fact that there were a couple of years out of the six elections you ran in, only 2 of them you had primary opponents, were those tied to sort of political issues going on at the time, or just an interested candidate happening to be around?
A little bit of both. The first one in 18 he was the mayor of Concordia, and I think he had a strong interest in getting involved. And I think that some votes that I had taken maybe reflected not as conservative as some of the groups would like me to be. And
Yeah.
so he had some support with some of the more conservative groups in the industry. And then the other one, he was not recruited at all. He just wanted to run. And yeah.
Well, we'll get into some of those political tensions and even intra-party tensions on important policy issues a little bit later in some of our discussions too.
Yeah, it makes it difficult when your party comes after you.
Yeah, yeah.
Yeah.
When I first moved back to Kansas in 1998, shortly after that, the chair of the Republican State Committee stepped down to run against the sitting Republican governor, and that was an eye-opener to say, oh gosh, this is some really intra-party tension here.
Yeah.
One of the issues that you've been involved with for many years in your role in the legislature is around Medicaid and how that Medicaid program operates in Kansas, and the longstanding and ongoing debate about whether or not Kansas should expand Medicaid. And I think my first question is it still an ongoing debate about whether Kansas should expand Medicaid, or is that debate settled now after 10 years or so?
Well, that depends. I don't think it's settled. It depends on, a lot makes a difference what happens at the federal level now, because I feel like they're kind of dismantling it. But I think that, I can't remember which year that we stopped trying to introduce it during every session, probably 22. But it's still on everyone's mind.
Okay. So you think there is still a policy discussion around it, maybe it's just not as obvious as it was for several years?
Not as obvious, not as intense, not as frequent. It's just, at some point, you've got to face the reality of the political winds that we have and move forward and wait for a better day.
I think in trying to think about expanding Medicaid, a good place to start is what's Medicaid? And let's just start with, what is Medicaid right now? And it's a very large item in the state budget, one that you as a legislator had to deal with frequently. Tell me how the Medicaid program is viewed in the legislature as a program that's been around for 40, let me do my math here, over 50 years now.
Yeah, and I was involved when I first came in with the vote to privatize. I think maybe they made the original vote the year before, and then there was a year delay before adding the IDD, the intellectual disabled, and then and I think maybe that we had the PD on there too.
The physical disability in addition to the intellectual and developmental disability.
Yeah, I think both of those were added a year later. And so I was supportive of that. Managed care is difficult, but it just had to be done. It was really too costly the way that it was being run by the state.
You mentioned privatizing it. We've talked in previous interviews with people about privatizing the child welfare system in Kansas. When you talk about privatizing Medicaid, let's just explore that for a little bit. What does that mean even? So
Kansas chose to have 3 managed care organizations, which are the MCOs. And well, more than 3 applied for it, but they contracted with 3 of them, and then they take on the Medicaid recipients are divided amongst those 3, and they take care of managing all of that.
Okay. So some states, patients that get medical care, the bills go straight to the state agency, and the state agency processes the bills and does all sorts of attempts to improve care and quality and all those sorts of things. But in Kansas, we chose to contract that out to these
Right.
MCOs, the
Yeah.
managed care
Fee for
organizations.
service was that was the way
Okay.
that we were before.
Okay.
And then we transitioned in 2012 to 13 to the managed care. And we pay per person a set fee, and then the managed care organization finds out, they figure out a way to care for that person, and they have some added incentives for them to have a healthy lifestyle. I think it's evolved into a really good organizational structure.
And the total spending on Medicaid in Kansas, last I looked, was about $5.2 billion a year. And because Medicaid is a joint program between the federal government and the state government, about 65% of all those Medicaid dollars are paid by the federal government. So about a third paid by Kansas, but still it's the second largest item in the budget after education.
Yeah, right behind K-12. Well, I guess it's all of education, and that's what it's seen as when you ask about how is it viewed in the legislature. Those who are not involved in the social services see it as a big money pit. That the price that goes up all the time, and the cost and. But those of us who work with it realize that's just the part of the public service.
You were on the Social Service Budget Committee at different points in time during your term in the legislature. Yeah, so you got to deal with those gnarly issues.
Yeah.
Yeah. So do people think of Medicaid just as a welfare program? Is it for working poor? What's again the conception across the street in the State House about who's in the Medicaid program?
Oftentimes I hear that they think that it's just the working poor. It's people who are being lazy, who aren't taking advantage of opportunities given to them, who are sitting in the basement of their mother's house eating bonbons, and that's really not what we see. I think that there is, in every program, there's going to be some abuse of the system.
Yeah.
But, sitting on the Bob Bethel CanCare Oversight Committee has given me a lot of view and perspective of what others think, by the questions they ask, and that sort of thing. And it seems like those type of questions come up from like a newer member. But once somebody's been on that committee for a little while and they see what we're dealing with and the people that are being helped by Kansas Medicaid, they understand that it's not just something to take advantage of. We have an excellent inspector general. That we did not have that position for the first few years of the program.
Right.
And it was housed at KDHE, and they
versus the Attorney General's office.
Well, now it's over to the Attorney General's office.
It got moved.
Yeah. And so Steve Anderson, I believe, it's still in that position, and we made sure that he has been funded to enough employees to find that fraud and abuse. And I think we have an excellent program in Kansas that weeds that out.
It's such a big dollar amount, $5 billion, and obviously the legislature's looking to save money and reduce waste and fraud whenever they can. You were talking about sort of who benefits from the program. About 2/3 of that $5 billion actually goes to care for the elderly and the disabled.
Yeah.
2/3 of all the Medicaid spending. Most of the enrollees are adults, pregnant women, and children, but they're relatively inexpensive to take care of. But 2/3 of the spending is on the elderly nursing home care,
Yep.
long-term care, and people with disabilities. So when it comes to squeezing that budget down and affecting those sorts of people, it can be a tough row to hoe.
Yeah, and you know, in my early years in the legislature in 13, 14, we were cutting the budget deep.
Yeah.
And they kept looking at those numbers and wanting to cut, but you just can't. You know, we did make some cuts at the Osawatomie to the point that we, you know, the state mental hospital, and we lost our Medicare certification, and it was
Yeah.
costing us $1 million a month to cover for that,
Yeah.
because we were not receiving any Medicare, and I believe that went on for a year. That's where we were making just cuts that were too deep.
Yeah, that was a rough time.
Very
and
painful.
That hospital, that was very stressful for them, obviously. I want to talk a little bit, before we begin to talk about expansion of Medicaid, let's talk about one more part of Medicaid, which is who, from an income perspective, who's currently eligible to participate in the Medicaid program. And I looked up recent numbers that children, so people under 18, are eligible up to a family income of about $80,000 for a family of 4. So that's one parent, 3 kids, 2 parents, 2 kids. For a family of 4, if you're a child, you can get Medicaid coverage up to about $80,000 income. If you're a parent in that family of 4, that same family of 4, your family income has to be below $12,000 in order for the adults in that family to be covered by Medicaid. So, you know, we're talking about right now for adults at least, and I'll say if you're an adult that doesn't have children, you're not eligible for Medicaid at all in Kansas, unless you have a disability or you're an elder person, those sorts of things. But childless adults that are non-disabled in Kansas aren't eligible at all. $12,000 if you are a parent, and for kids up to about $80,000, again for a family of 4. Those rules are up to states to debate and determine. It's a federal state joint program. Kansas has some of the less expansive income eligibility for Medicaid. Is that something that people talk about, of sort of what, for children it is a federal level, so that's consistent, but for adults, was that something that came up sort of when you're talking about money, you know, what level of income are we talking about? Where do most people think that you should be eligible for getting health insurance?
Yeah, there was a lot of discussion about where those levels should land. The problem that we had with expansion discussion was what CMS would accept. And
that CMS being the federal agency that oversees Medicaid and Medicare.
Yeah, and they, at the time that we were working on it, they were refusing states that would drop down to the 100% of the federal poverty level, which I don't remember what that number was.
Right now, for a family of 4, that's about $31,000,
Okay.
100% of the poverty level.
Yeah, so, you know, the way that the Medicaid expansion had it at 138.
138,
Yeah,
yes.
138% of the federal poverty level. And so some of the states would compromise and go with the 100%, and that was being turned down by CMS. So even though we were having the discussion, we knew that we couldn't really jiggle that number around very much.
So the Medicaid expansion, well, let's walk through the discussion about that a little bit. The way the ACA was designed, it was going to expand Medicaid in all states up to persons up to 138% of the federal poverty level, which again today is about $43,000 for a family of 4. So still working poor, as you used the term before. So that was how the ACA was designed. But then several states were reluctant, and there was actually a lawsuit that went to the Supreme Court, and the Supreme Court said, no, the federal government can't require this. They can allow states to do it, but they can't require it, so every state can make their own decision. And as of now, as of today, 10 states have not expanded. Kansas is one of those states. And a couple of them, they did finally get permission to do what you said, go up to only 100%. Wisconsin and Georgia, I think, have done that. But CMS, the feds were not real interested in doing that. They wanted to keep it at 138. So we're one of 10 states that has decided not to expand Medicaid. And again, it doesn't affect kids. All the kids are covered up to 2.5 times the federal poverty level already. It's just increasing from that below $12,000 for an adult in a family of 4 up to about $43,000 that those people would be eligible. So yes, we're one of the states. Was that an issue about, well, gosh, all of our neighboring states, for example, have expanded Medicaid, and most of the states that haven't are in the South, and then a couple of the ones up north have alternative type programs, but we sort of are an outlier in that way. Did that come up in discussion?
Well, that a little bit later. Early on, Missouri hadn't, when I was working on it, Missouri hadn't, and there was a lot of discussion about the fact that we would have people coming across state lines then to take advantage of our Medicaid.
Moving to Kansas to get Medicaid. Okay.
Yeah, and at the time, I don't think that we were working on it. I don't think any of the bordering states had expanded yet, and they did that by a public referendum
In Missouri.
in Missouri and Nebraska.
Nebraska, okay.
So that otherwise I don't know that they would have gotten there either. But going back to the discussion of when it all started with the ACA. One thing that I explained to my colleagues, and a lot of people don't realize, that prior to Obamacare, the hospitals, and I'm going to oversimplify,
Sure.
but the hospitals would receive federal funding directly, called dish payments.
Disproportionate share hospitals.
I was hoping you would say that.
DSH, disproportionate share hospitals.
Yes, and they received money from, and so with Obamacare and making the assumption that every state was going to expand Medicaid, they did away with the dish payments. So the hospitals, just on the heels of going through sequestration, which that was, at that point, they were being paid for Medicare, they were being paid 102, 103% of cost. And by each year, that ratcheted down to, I believe, 98%. So their reimbursement rate is below cost. And so you're already losing some money there. And then they lost the dish payments, thinking that was going to come back to them through the state Medicaid program. And then we didn't expand.
I think that's a really important point. And even I think at the federal level, the American Hospital Association finally got behind Obamacare or the ACA because of that argument. Well, we're going to cut these other sort of indirect payments to hospitals for indigent care, but there's going to be so many more people covered by Obamacare or Medicaid expansion that the hospitals are going to come out doing okay in the end. Did that happen?
That did not happen because we did not expand Medicaid.
Yeah, so the states that did expand Medicaid, maybe that was more of an even trade for the hospitals.
Yes.
But states that didn't expand Medicaid
they're doing without.
Yeah.
And there, at once upon a time, if you had enough people with private insurance in your community, that helped you get, make it over the top. But through the years with the evolution of hospital finance, the private insurance industry now, when they go to negotiate what they are going to pay you, the rural hospitals have no bargaining power, And that's why you're seeing a lot of systems popping up to help them have some negotiating influence. But with the rural hospital, if they're independent, they don't have any, so the private industry is saying, we'll pay you what Medicare pays you.
Yeah.
And they don't pay any better than that. So, they find other ways to survive, but it's really a struggle for the rural hospitals by not expanding Medicaid. And I remember in a hearing when the Secretary of KDHE told me how much the rural hospitals would get as a total, because a lot of the indigent are in the cities, and it would go more, to the bigger hospitals because they take care of more of those patients. But to her, it sounded like a very low number that the rural hospitals would get. But what she didn't understand is that $300,000 to a rural hospital was a make it or break it.
Yeah. That could be the difference between a positive 1 or 2% margin and a negative 1 or 2% margin. Yeah. Yeah.
And if it was positive, it would pay for a new physician to come to the community, or a new piece of equipment. So.
Yeah. And just to throw one more number out there, there's about 250,000 uninsured persons in Kansas, and the Medicaid expansion would cover about 63,000 adults would be newly eligible for Medicaid if Kansas expanded. So it could make a significant dent in the number of uninsured persons in the state.
Oh yeah, it could. And there was a lot of discussion when I was new in the legislature about the woodwork effect. Remember that?
Yes.
That people would come out of the woodwork that qualified already for Medicaid, but were not, for whatever reason, had never accessed it.
No.
And we really feel like at this point, with all the discussion and that they've already come out of the woodwork at this point. So we're pretty confident with those numbers.
Yeah. And there are people that for various, the complexities of applying for Medicaid and having to recertify however often they're required to, there are some that could be on it that are not on it. And a lot of cases, that's a situation where if the parents were eligible, they'd be more likely to get their kids on the program. But since so few parents are actually eligible for Medicaid, that affects the number of children enrolled too.
Yeah.
Yeah. But yes, that woodworking effect was a big policy discussion for a long time.
Yeah, it really was felt like there would be way too many people coming onto the system.
Or, as you said, I live in Kansas City. At the time, I was living about a block and a half from Missouri. And there was a lot of discussion about how, whether people would relocate in southeast Kansas and the metropolitan Kansas City area.
But to your point about the surrounding states, it makes sense at this point that, we're an outlier for sure.
Yeah.
And and we were told that they would struggle with it and fail, and they haven't.
Yeah, exactly. And then there's the conceptual discussion of sort of the value of having people in your state with access to healthcare.
Absolutely.
Yeah.
Yeah.
And if you're not going to cover them through Medicaid or other insurance, what are the other mechanisms that states can use to provide care to those people through safety net clinics and those sorts of things?
Yes.
But when state budgets are tight, it's difficult to backfill some of those needs.
Yeah, and I remember when we were moving to the MCOs, to the managed care, that I remember Dr. Collier coming, when he was lieutenant governor, coming to my office and visiting about, this gives us the opportunity to provide the right care, the right time, the right place. And so if move forward a couple of years and we're talking about Medicaid expansion, and I used that because that's exactly what it is. Providing Medicaid coverage is good coverage. And they get the right care, the right time, at the right place. And, all of the providers would much rather see that, the patient in the office and have well checks and provide healthy information than to wait until they're sick and have all of that treatment done through the emergency room, where you're required to take care of anybody, whether they can pay or not. So,
and you're right, having that transition to the managed care Medicaid system years before positioned Kansas well. And even since then, Kansas has been innovative in using managed care to expand to the developmentally and intellectually disabled population, other behavioral health services and stuff like that. So in some ways, we've been leaders. In others, particularly around the expansion, we're one of the holdouts.
Yeah, that was a really tough vote for me, by the way, because
which vote?
When we added in the developmentally disabled, because they did not want to be there, but they did not want to be included, and I think that there might have been some that struggled, but we've gotten through a lot of that, and it's really good care. And I'm pleased with what we saw through the oversight committee. But it had to evolve.
Well, that was a tough vote, a tough decision by the legislature, and a big priority for Governor Brownback and Governor Collier eventually on that. Great. I'm going to ask you to talk a little bit about inside baseball across the street in the State House. We've sort of talked about this at a high policy level. What was it like being in the legislature between 2014, when states were first allowed to expand Medicaid under the ACA, and when you left just a couple of years ago? What were those conversations and battles like, and how did the committee work around those sorts of issues go? I know you were involved in very significant ways.
Well, it just made sense to me to expand. To me, it was logical. I'm not, I talked earlier about getting involved in politics, but I'm really not a very political person. I want to solve problems, and I will work with anybody that is willing to work towards solutions. And just sitting in the health committee and listening to the testimony of what Medicaid expansion would be, it just made sense. And I from the beginning have been an advocate that this is something that we should do. I've worked around the hospital finance through the years and watched them adjust to the different federal laws. And to me, this was just another adjustment. Because I was aware of the dish payments going away and the fact that we needed that income flow back to our hospitals. And I wasn't really treated as an outcast, but I knew that I differed from my committee of my Republican colleagues on the committee. By my second year, I was the vice chair of health. I don't know if we had discussed that, but there was a resignation, and we had so many freshmen come in 2013 that there really was a very short bench, and so they asked me to serve as the vice chair, and so I was a bit of an outlier with a leadership position on the committee, so I was trying to walk that tightrope. But then I didn't really have my enough years behind me to be really out in front of the issue. But because of my advocacy, I did lose that vice chairmanship and my position on the committee, along with Don Hill and Barbara Bouillet, both colleagues on the health committee.
They were also supporting Medicaid expansion and
yes,
were taken off the health committee
They were
along with you.
Republicans that were removed from the Health Committee. And so that was...
To those of us sitting outside the legislature when that happened, it sort of made us sit up and take notice. Is that something
Well,
that had
I
happened
think
commonly, or was that a new thing that was happening?
So I was I was still in my first term. So it was, I don't know whether it was commonplace. I don't think it was. It kind of it blindsided me. I got a phone call in November that I would have a new committee assignment. At that time, I was no longer vice chair or a part of the committee. And I think that it started an ugly trend that it's used now as punishment for votes. And it happened again. I don't know if it was it was last session.
Last session, yeah.
And, but it kind of backfired because all of a sudden then I'm getting contacted by media from outside of my area, and Kansas City and Washington, D.C. and St. Louis. And I developed some relationships then with some journalists that lasted really the whole time I was in the legislature. We kind of would catch up on where Kansas was as far as Medicaid expansion. But it gave me, it kind of set me free, because then I didn't have to walk that tightrope anymore. I was devastated. I was really upset. But it gave me the opportunity that, well, what else can they do to me? Yeah. You know, my district's already voted for me, so they're my boss, and so, you know, I did lose an office over it, and so I made my new office as pretty as I could, and that, you know, those kinds of things you can. They can use the leadership can use to try to influence. And with some people that helps, or it matters to them. I had, in my last, 3 or 4 years, I would have freshmen come and say, how do you get away with voting the way you do and still be friends with leadership and still be a committee chair? And I said, I drew that line back when I was brand new. Yeah. And that's what you have to do. Just stand up for yourself and what you believe in. And once that you have that freedom, they know and they expect that from me. Yeah. And they would be shocked if I didn't vote for it when it came to the floor.
So you were able to take on other leadership roles in child services and other areas, not back in the health realm, but in some of the other realms.
Yeah, yes, not immediately. Yeah. The first year, my new committee assignment was general government budget, and that was very interesting because it gives you a wide range of budgets to look at and learn more about the state government. So I took advantage of it while I was there, but still missed my health committee, and I would go visit them and watch committees when I could. But I was returned as vice chair the next year. Okay. And then served at least one more term as vice chair. Yeah. And then I was told that I would never chair that committee because of my support of Medicaid expansion. But that they did want to be able to place me somewhere.
Well, and the 3 people, yourself and Barbara Bollier is a physician, Don Hill's a pharmacist, you're married to a physician, and we're very involved with the hospital in your hometown. So 3 people that really had some insight into how healthcare and insurance works. Yeah. That was a lot of intellectual capacity to lose from that committee.
Yeah, it was. And I will say that it was very noticeable when I did go back to visit the committee that they would have a lot of informational hearings that they weren't digging deep into any topics.
Those are tough issues that committee deals with, and not simple issues either. Right. Tell me a little bit, again, there have been several polls that have shown Medicaid expansion has a majority of Kansans who support Medicaid expansion.
Yeah.
And I think there's an assumption that there's a majority of people in the legislature that if they were able to vote on it, would vote for Medicaid expansion. How does the legislature work in a way that leads us to where we are now on the decision around Medicaid expansion, if those are really true? And maybe you don't believe me, or don't believe what I said, that the public and members of the legislature would actually support it.
No, I've seen the polling and more than one source that absolutely, and I talk to people in the public about it. And it's generally considered kind of a stain on Kansas that we have not. Well, one thing is that when legislators don't vote for it, I discover that when I'm around the state and talk to people, that they like their legislator, and they're one of the good guys, but really I'm not going to tell them that. I might tell them they really should vote for Medicaid expansion, but I'm not going to tell them that they're not there to move things forward, that they are blocking us. But that is a frustration, that it doesn't matter where I go, they're okay with their legislator. It's the other guys that are all a mess.
Yeah.
But I think to the point that you're making, that there are a lot of legislators that would vote their district and would vote yes for Medicaid expansion. But leadership wants to protect them from that vote because it's political, and they've politicized it. Yeah. And it's political as far as the different organizations, the conservative organizations, that they don't want them to be, have to deal with a primary against them. But then on the other hand, they don't want them to have to vote no and be against what their community is asking for.
It's one of the tough issues that you guys face there.
And and the ways that they do that will be to keep a bill off of the floor, that we could bring an amendment, a Medicaid expansion amendment. Which
was attempted a few times.
Yeah, and was successful once.
That's right.
And in 2019, when we pulled a bill out of committee, and we had to vote, and we had the votes to bring it to the floor, it was determined to be not germane. So then we had to make a really tough vote of disagreeing with the chair of the committee and overrule the germaneness issue.
Yeah.
And I'll tell you, when it worked, I mean, we planned this for a long time, many secret meetings. And when it worked finally, because I mean, there'd been a lot of years that I didn't know what to do. I mean, it was, okay, now what? We have to start talking. And but we were successful, and we did pass it out of the House that year.
But it didn't become law because?
Because it stalled out in the Senate. Okay. And that they had the votes there too. But there are ways of moving things from committee to committee so that it doesn't get pulled out.
Yeah.
And then, of course, the majority leader in the Senate came back with another bill the next year, and that he didn't have the votes. Then it had a whole different political atmosphere. But I wanted to mention a little bit of the struggles that we would have, because the arguments against expanding, they kept changing every year. And when we first started, it was dealing with the fiscal note that they brought, which was a disaster. We shot holes all the way through the fiscal note, but it was too
The
much.
fiscal note saying that the cost to the state would be much larger than anticipated. Is that?
Yes.
Okay.
And the figures that they used, I can't remember, it was so long ago, but one thing stands out was that when they did the calculations, they only figured that there would be 40 babies in the state of Kansas, born in the state of Kansas. That one just blew me away. But there are numbers that can be adjusted with how many people in the prison system and Native Americans, and all of that helps bring that number down because they're already covered.
Yeah.
And anyway, that was our first go round. Then the next year it was that we were going to have a Republican president and it was going to be repealed. And we did have a Republican president, but the Congress was not willing to take that away from their states. And so that didn't happen. I'm trying to remember, the next one I believe was saying that we could not expand Medicaid until we did away with the waiting list for the IDD, PD wait list for services.
So say just a little bit about what that was a mouthful. Tell me what those programs, who were the people on that?
That's the
list?
Intellectually disabled, the intellectually developmental disabled, and the physically disabled.
Okay.
There is a wait list that was an embarrassment to the state that was like 7 years long. But
So you're theoretically eligible for Medicaid, but the state didn't have the funding to provide those services to everybody who was eligible.
No. They were being provided services, but the wait list that was brought up to use against the expansion discussion was for in-home services.
Oh, yes.
And so, but they didn't understand that.
They were getting a certain basic set of services, but not a particular add-on set of services, yes.
And so the IDD and the PD folks said, wait a minute, we're already getting Medicaid. Don't put us in the middle of this.
Okay.
And they were very vocal that they wanted to see Medicaid expansion, and that was not a good argument. So that argument only lasted a year, although some people would still bring it up later. They just didn't understand.
Yeah.
But we did work on doing away with that list in more recent years. And I'm glad we did. It was an important part, but it was not the same issue.
Yeah.
Then entered the bishop, and the Catholic Church got involved, and the public would have to approve the constitutional amendment on abortion before they would get behind Medicaid expansion. So Medicaid does not cover abortions. And so we're talking apples and oranges. That was not a good argument, and the bishop shouldn't have gotten involved in that. But that it is what it is. That's what stopped it that time around. And
so a lot of different policy approaches for opposing Medicaid expansion. And probably maybe that one was maybe a little more unique in Kansas, but these are common arguments being debated in state houses across the country.
Yeah, I believe so.
Yeah. Okay, well, you made the comment at the beginning that you didn't think the debate and the discussion on this was over. It took, I believe, 30 years for all 50 states to finally adopt Medicaid once it was expanded. Arizona was the last state that adopted Medicaid 30 years after it had been created. So I guess there's still hope.
I have hope. When I left the legislature, I can't remember when I had a conversation with Governor Kelly, but she said, I just want you to make sure that when we pass Medicaid expansion, you come back for the signing. And I said, oh, I will be here. But it didn't happen under her term. So
she'll have to come back too if it ever happens.
Yeah,
I guess.
We'll meet up again someday.
Yeah. That's great. Well, thank you for going in deep with me on the Medicaid
Yeah,
issue.
sometimes I get going on that and get too in the weeds, so.
Well, you spent a lot of your energy addressing that program for a lot of people in our state that benefit from it, so thank you for all your work there. I want to bring us back to a conversation about being in Beloit and the involvement, all the different areas that you're involved with in Beloit that affected the health and the well-being of the community. Maybe not strictly medical types of things, but you've seen a lot, been involved in a lot in Beloit. Tell me about some of the things that you've done in your community, that your community's done to try to make Beloit a better, healthier place for people.
Yeah, well, you know, I did a lot of community service when my kids were young, through my church and the school and just different community projects. But when I really got into the thick of things was after I lost that mayor race. I was asked to be one of the leads in the capital campaign to build a new wing of the hospital. From that, we raised a significant amount of money, and from that we had some funds that we could use to develop a foundation. Yeah. So I became the executive director and developed the Mitchell County Mitchell County Regional Medical Foundation. Okay. I started it, and I can't think
if you remember the name.
And through that, then I worked on some grant writing. We had a team that worked on making it a more walkable community, so lots of sidewalks being built. We're still working on the plan. One of the things we did was bought a house that's right next to the hospital that was from the Civil War era. Wow. And we call it the Purdue House because Dr. Purdue was the Civil War physician that he literally operated in the back room, and it was it's just a really neat old house.
I've seen pictures. It's limestone and just classic architecture.
Yeah, and so we had to get some grants to do some work on it, but we developed our own little Ronald McDonald House, if you will. Yeah. And so we have 3 rooms that we're a small critical access hospital, but we're regional. And so we end up with a lot of families that either have someone in the emergency room or someone in the hospital that need a place to stay. Yeah. And it stays quite busy, the 3 rooms. And I worked on that in the early 2010-ish era. And that was kind of fun getting that started, and then the foundation has our offices that are also on the first floor of that building.
Oh, neat.
And then with the foundation, I did a needs survey of the community and discovered that transportation was a big issue. And so we started looking into what public transportation would look like, and the grant that was issued in Beloit was to the senior citizens. But the seniors were about to lose that grant. I don't know if they knew this or not, but they just weren't very good at grant writing. And so I, along with the hospital administrator, went to the seniors and had a discussion with them about us writing the grant, kind of taking it over as the foundation, but we would still provide for them, and we would provide we were going to develop a board and would provide a position for the senior citizens on that board. And so we went, we wrote the grant.
Was this a federal or state grant or foundation? State, okay.
State public transportation. And we received the grant, and we went from having 19 rides in June of whatever year that was. The next June, we had, I used to say this number all the time, 640 or something
Wow.
like that.
Wow.
It was very, very needed. And we won an award for Small Transportation System of the
Yeah.
Year. And we did have a board then. And now we have, and we prioritized health trips.
Yeah.
Now we don't have to do that because we have enough vans that are out and about.
Yeah.
And we have gone regional. We've moved up into Jewell County and west to Osborne County.
You know, having practiced medicine for a number of years, it's amazing how often we assume patients aren't interested in being compliant and showing up for appointments. But when you realize the difficulty older citizens have, people with disabilities or people that don't have the financial resources, you know, if they've lined up a ride with a friend and something happens to that friend, that patient doesn't show up for the appointment.
Right.
And from the doctor's office, it's, oh, there they are again. But transportation is a major issue around health. And I would say the same thing around getting access to good food. If you don't live near a grocery store, you need to be able to get somewhere where you can get healthy food for your family. So I think that's amazing. And that was the foundation that worked with the senior citizen group to put that together.
And then we developed a board, and it's Solomon
that's
Valley
awesome.
Transportation Board.
That's awesome.
And it's, you know, we have a lot of our citizens who need to go to Salina for cancer treatment. You know, most of the time that's where they're headed, is for cancer treatment. And then we used to have a lot of people travel to Concordia for dialysis on a daily basis.
Yeah.
I don't know if that's still happening or not, but now we have a system where, if you know your geography there, we go from, our van goes from Beloit over to the junction with I-135.
Okay.
And the Concordia bus comes down from the north and picks up our patients. And
Transfer there.
a lot of times that we coordinate with them.
Yeah.
And then a lot of times the Salina van will come up and go and make a trip to Concordia.
Well, major issue, major challenge.
Yep.
That sounds like a good win for the community there.
Yeah, you know, and going back home, after being in the legislature, I did not want to get back into all of the things that I didn't want to be looking over somebody's shoulder and saying, this is the way we used to do it, and this is the way it should be. And so I had to find new things to get involved with. And I have.
So thinking again at the community level, one of the issues we've been talking about in this whole series is about how healthy we are as a state, as communities, as Beloit. And I think we've talked a lot about insurance and healthcare, but we were just talking about lots of other things that we know influence how healthy we are as a community. And there's a ranking of states that comes out every year, the United Health Foundation puts out. And in 1991, Kansas hit a high spot of, we were ranked the 8th healthiest country in the state. And over the following decades, we fell to a low of 31st just in 2022. We've bounced back up a couple spots. We're about 27th right now, the latest ratings. But that's the largest drop from number 8 down to number 31, the largest drop of any state in the country over that period of time. We were both involved in a lot of health policy stuff over that time. So it's like, gosh, well, how did we, do that? And I want to point out, it's not that health in Kansas got worse. People are generally living longer. Deaths from lots of different things are getting better. Smoking rates are down, those sorts of things. But we're not making as much progress as quickly as other states. So our relative position is going down. When I know you've been familiar, you get inundated with rankings and things, county rankings, state rankings, but as a policymaker in your role there, how do you think about those sorts of rankings? Are they helpful? Are you skeptical of them? How can they be helpful to promote good policy discussion around health?
Well, I think I'm always skeptical just because I always, check to see where it came from, what all they're measuring and that sort of thing. But you have to start somewhere, and you have to measure and see where you're at. I think it should help us with developing policy. It becomes politicized. I strongly believe that that our fall from grace has been with the cuts that we made in social services and with not expanding Medicaid. Access to care is such an issue,
Yeah.
and I can't even begin to go into that topic because it's so broad. But I would think that that's probably our biggest downfall on there. I would guess that the reason we popped back up a little bit is the work that we've done in the mental health arena, and then the new hospital designation.
The rural hospital designation.
Mm-hmm.
Okay.
Yeah, I think that will be, is and will be very beneficial. But, every community wants to have a hospital.
Yeah. Yeah.
So, what that looks like.
Yeah. Do you think, is there anything that stands out in your mind? You mentioned a couple, but this is a long period of time. We're talking about 30, 35 years.
Yeah.
If you had to sort of find some common thread through that period of time of why we would have declined relative to other states as much as we have, again, that's a long period of time. What sorts of ideas would come into your mind?
Well, of course, I've only been involved with the legislature for a portion of that time. I think that there's been a lack of respect for expertise, and that's, again, that wouldn't go clear back to the early 90s. But I certainly saw that in the legislature with how people would be treated when they would come to testify, and in discussion of scope of practice issues and those type of things. But if we're truly listening to what those providers, what their needs and wants are, I think that maybe some different decisions might have been made.
One of the areas that Kansas tends to lag other states in these rankings is around the supply of healthcare providers, particularly mental health and dental health services. You mentioned at the beginning of this discussion that you and your husband were brought to Beloit because of a scholarship program for KU medical students to practice in rural communities. How does the supply of healthcare providers, again, you mentioned mental health, dental health, how do you think that issue affects rural communities like Beloit and other communities around our state?
I think that it ebbs and flows as far as the success. For many years, the program was not that successful because young people just didn't want to, they wanted to move to the cities.
Yeah.
And my husband and I were already married and had children by the time we moved to Beloit. So, but when you have some of the single physicians coming out of school, they usually want to go to the bigger cities, and the restaurants, or all of that younger people are used to amenities, and we can't offer all that. We offer a lot of other things, and that's what young people are starting to see now. I don't know if COVID had anything to do with that. I kind of think it did, but that we have space and friendly and safe and
Yeah.
good schools and all of that. But you know, back to the scholarship a little bit. When I was early in the legislature, we added, and I think it was my bill that we added psychiatry, because there's such a shortage, and it's not been successful. They just can't even find enough people to accept the money.
It's a challenge even in communities, bigger communities like Topeka and other big cities.
Yeah.
We were talking before we started the discussion about, we have a new medical school in Kansas, an osteopathic medical school in Wichita. You were telling me the numbers of graduates that they've had recently?
Yeah, they just graduated. I think he said 3 weeks ago that they graduated 60. And 58 of them had matched for their residency.
Great.
So,
and there's a new campus going up in Wichita, downtown Wichita,
Yeah.
a joint effort between WSU and KU around the health sciences as well. So
Yeah.
certainly training more doctors and nurses and other kinds of allied health professionals is part of the challenge.
Yeah, those are a lot of discussions that I was lucky enough to be involved in on appropriations.
Yeah.
And so being able to advocate for that and for progress at the University of Kansas Hospital. And, you know, I think that it was really painful to go through those years of so many cuts, but it was an interesting time to be in the legislature to see that all come back, and the funding started coming back in, and we were able to revive the social services, and then actually, you know, we have a lot of shortage in the mental health arena, and for us to be able to add that new hospital in Wichita, and
the behavioral health hospital, yes.
And then the combination effort with the school, that's all very exciting, and nice to see that move forward. I had a thought there that talking about appropriations. Can we back up to discussion on Medicaid just a little?
Sure.
With appropriations, there's been a major effort to improve the reimbursement rates with Medicaid, and you know, that's a long time coming. We were one of the lowest in the country. But when I was mentioning that the roadblocks to expanding Medicaid, that should not be a roadblock. I think that the providers would all tell you they would much rather their patients have coverage so that they could take care of them the right place, the right time.
So if a patient is uninsured and they have to get taken care of at a hospital or a doctor's office, they're going to get care. It might not be everything that a fully insured person might get, but they're going to get good basic care. So even with the low payment rates for Medicaid, if there was expansion and they were covered by Medicaid, the hospitals and the providers would be getting some payment for those services, maybe not as much as they'd get from a privately insured patient. Is that what you're talking about?
Oh, yeah, not even close.
Payment reimbursement rates?
In fact, I've had clinics tell me that it costs them more to hire the staff to run the Medicaid through the system than what they bring in from it. They would just as soon they not even have it at the clinics. Now, the hospital is a different story.
They have to see any patient that walks through their door.
Yeah.
But and it's a challenge in every state, even states with expanded Medicaid and states with slightly better reimbursement rates. It's a challenge to get providers, doctors, specialists to participate in the Medicaid program, because the payment rates aren't as attractive. But
and they limit the numbers. And my dentist just told me at my last appointment that she's no longer accepting Medicaid, which is sad.
Yeah, oral health and mental health, as I said, were two areas where Kansas really lags. The other areas where we tend to fall behind other states is around tobacco use rates and vaping now, and obesity rates,
Yeah.
which are, again, not things you necessarily think of as happening in a hospital or whatever, but certainly they happen at the community level. Yeah.
Well, and there again, if they are being, if they're going to regular doctor's visits, and they would have those discussions with their physician on healthy habits, and but if there's no coverage for them, then they
Yeah.
they
Yeah.
wait for that heart attack to happen.
Yeah, and all those other support services like transportation and access to healthy food, those sorts of things, yeah.
Yeah.
All right, good.
Yep.
I want to touch on another area that I know is near and dear to your heart, and that's around children's services and child welfare services. Talk a little bit about your involvement in those issues while you were in the legislature.
Yeah, well, you know, when I told you that they said that I would never chair health, what else could what could we do with you? There was a committee called Children and Seniors, and I thought that would be a good fit, and I care about both children and seniors, and so I became chair of that committee, and probably my first term, I mean, we passed some important legislation then, but and had a lot of very important informational hearings, and I was learning as I was chairing a committee. But then the start of the next term, I sat down with a good friend who is in the industry, and we went through a list of things that we saw were needed in the foster care realm. And let me back up. Just one of the things, two of the things that we did that first term was when I went from working on Medicaid issues to the managed care child welfare system, there was no oversight. I mean, DCF, Department of Children and Families, but
no legislative oversight.
no legislative oversight.
And that was like, that whole privatization of those services, which happened before the Medicaid privatization even.
Yeah, it had been going for quite a while. I looked into it through legislative research, and there was an oversight committee back in the early 2000s, I believe. And it really dissolved through the years. And so we got a bill passed to establish a joint committee on child welfare oversight. We also, at that point, developed a senior care task force. And so we were dealing with the senior issues.
Yeah.
And then, unfortunately, the senior part was taken out of my committee, and it became Child Welfare and Foster Care Committee. And that's at the time when we went through the list, and we divided everything up between what needed to go be addressed by the agency, what needed legislation, and what needed appropriations. And we just worked from that list. And it's amazing having a list, how more efficient that was.
Yeah.
And so through that year, maybe next 2 years, I think we checked about everything off of that list.
And you chaired that committee up till the time you left the legislature, right?
Yeah, yes.
Yeah. Okay.
Yeah, and so I mean, we did some really big stuff with the sole permanency, family permanency, which allows older youth to find permanency with an important person in their life, a teacher or a church leader, someone like that that's important to them. That one, we are the first in the country to do that, and we worked with the Casey Foundation on that. It was actually, the bill itself was written by young people who had aged out of the system.
Yeah, I think that's an awesome part of that. I mentioned I am a volunteer with the court-appointed special advocate program, and we're just now starting to get training on that sole family permanency program. So hopefully the fruits of that effort will continue to come to bear.
So another thing that I'm really proud of was the legislative effort that we made to establish the CARE network. And the care network, the bill itself was actually just developing a structured payment system to educate physicians across the state and pay them for their education time to identify abuse or non-abuse.
Yeah.
And so when DCF gets phone calls with a complaint of a physical abuse, then they contact Children's Mercy in Kansas City or KU Wichita, and they have certain staff
that are trained in that.
And it had been going on through Children's Mercy for a little while as a pilot. And that was just in northeast region of the state. And so then the bill that we had established it throughout the state, and it's been going for a couple of years now. They do the training in the fall. It's both for physicians and mid-levels. It's in Salina, and it's, I don't know, 2 or 3 days, and then they follow up with, they have a mentor a physician that's already been through it. And then when they do one of these exams, they take about 3 hours, or can, with all the testing. And so the set fee that the bill provided then would pay them for the x-rays and that sort of thing, and the time. And then also any follow-up phone calls, the time talking to their mentor, showing up in court, and all of that sort of thing. So, like I said, it's not, the public doesn't see that one in action, but it's there and it's working.
Yeah, that's really important to document what happened or didn't happen in a case where that has been raised. We're glad we have trained professionals to help collect the information and evidence on that.
Yeah.
That's, I wasn't aware of that program. That's great.
Yeah, it's I think one of my favorites, and the whole thing is that the process. We talk about the process of things. When the lobbyist brought that bill in and showed it to me, I don't know what kind of mood I was in, but I said, well, I'm not having a hearing on that. And I think she was about ready to cry. And then, anyway, we had several conversations about it, and it was actually a very good bill. And
that's neat.
And I'm glad that I changed my mind.
Yeah. Well, you covered a lot of important territory during your time in the legislature. Thank you very much for all of that service.
I enjoyed my service.
Any reflections on that decision to run for city council way back in Beloit, all the way through serving more than a decade in the legislature and leadership in different roles?
Well, I enjoyed all of it. I mean, I can't say I enjoyed every single day, but it really was such an honor to be in the position and to represent the people at home that I love dearly, and to be able to sit in those chambers and look at the beautiful paintings on the ceiling and the woodwork and think, oh, I'm so lucky to be here and to get to be part of our state government. And I made so many good friends, both legislators and the support system around the legislators and the lobbyists, and it's like a big family, and we fight a lot, and but we all love each other, and even when we disagree. And I know that it's not the way that it used to be when Bob Dole and Tip O'Neill would fight and then go out to dinner together, but that's sure the way I'd like it to be. And I think that I'm proud of my service being that way, because I disagreed with a lot of my friends, and we were able to disagree respectfully. So
That's a good way to wrap a bow around this conversation. Thank you very much.
Well, thank you. This was fun.